Operation 2005.
டாய்லெட் வந்து எங்களுக்கு அவங்க தான் வந்து கட்டி கொடுத்தாங்க.
அந்த தார் பாய் கொடுத்ததெல்லாம் எங்களுக்கு ரொம்ப உதவியாக இருக்குது.
குழந்தைங்க ட்ரெஸ்ஸுங்க தார் சீட்டு வீடு மாதிரி ஒரு தார் சீட்டு போட்டு தங்கிக்கோமான்னு சொல்லி அதெல்லாம் கொஞ்சம் கொடுத்துருக்காங்க. அதெல்லாம் எங்களுக்கு ஓரளவுக்கு பயனுள்ளதாகவே இருக்குது.
அந்த வீட்டுக்கெலாம் நல்லா மேடாக தூக்கி கொடுத்தாங்க. தண்ணி உள்ளே வராத அளவுக்கு இது மண்ணு கொட்டிகிட்டு இருந்தாங்க.
தாரல் கம்பெனிக்கார நிறுவனம் மட்டும்தான் சொல்லிச்சு, இந்த கலாட்டாவது ஜனத்துக்கு நான் செய்கிறோமா,
நாங்கள் பாதிச்ச மாதிரி அவங்களும் எங்களோட சேர்ந்து தான் பாதிச்ச மாதிரி எங்களுக்கு வேலை செஞ்சுட்டு வராங்க.
Operation 2005 brought humanitarian aid to a total of 21,500 people during the greatest crisis after the tsunami. The operation was implemented by the local NGO, Center for Sustainable Human Development. The implementation was supported and funded by the European Commission, namely the Humanitarian Aid Department, ECO, and German Agro Action, GAA. The operation was carried out in 3 localities in Chennai: Kargil Nagar, Kannagi Nagar, and South Coast Chennai, with 4 sectoral activities, namely distribution of non-food items, provision and improvement of shelter, provision of infrastructure for wet sand, and training in wet sand, as well as personal hygiene. Kargil Nagar, one of the campsites, accommodated 2,138 families. The shelter and basic amenities provided by the government was very inadequate. The people also fell victim to 2 fire accidents in June 2005. CSHD utilized the services of the volunteers of Suicide Prevention Movement in the rescue operations. After need assessment survey, 2,138 target families were identified by GAA and CSHD for further activities. A need-specific package of 30 non-food materials was arranged and distributed to 2,138 needy families. In consultation with the state administration and the community, CSHD and GAA designed a fire-retardant and waterproof PVC tent, which was approved by the administration and accepted by the people. Volunteers from Suicide Prevention Movement, community volunteers and individual families contributed in digging, leveling and fixing the tent. Thus, all 2,138 needy families had their shelter pitched by September 2005 and 9,500 people got temporary shelter. CSHD constantly monitored the cleaning of stagnating water due to the rains with the involvement of local community. Motor pumps were hired to drain the water. Certain key stretches of road were laid afresh to facilitate drinking water supply by tanker lorries. For ensuring sufficient drinking water, 14 water tanks with basement with a total capacity of 34,000 litres were installed, and 60 units of toilets and 40 bathrooms, as well as 3 platforms for washing clothes and 100 waste disposal bins were put up. All the infrastructure facilities are totally in tune with sphere standards. Active participation of families was a key to project success. For example, one family from each block monitored the management of waste materials and water. Training in use and management of wet sand facilities was given to 74 youth volunteers and 250 adults in 2 phases. They in turn trained the entire community through formal, informal and entertaining methods. The transformation of Kargil Nagar campsite was almost dramatic.
We implement the activities of awareness in water and sanitation. This is something that was very new for our beneficiaries, unexpected. At the beginning it was not easy to start the implementation and to start to talk about some delicate issues about toilets, cleanness, importance of being clean, keeping clean toilets, keeping clean hands, the importance of water, and all the things related to waterborne disease. But after the first embarrassment, we found very, very good cooperation with our volunteers that they pass the message to the population, and we have seen good results in the camp of Kargil Nagar.
But the people had to abandon the site due to incessant rains and floods. They were shifted to a school premises for a week and later moved to Ernavur, another campsite. 4 water tanks were shifted here and 2 mobile toilet units were installed here. Kannaginagar was yet another campsite which housed 1,020 needy families under inhuman conditions. 8 water tanks were renovated. A need-based package of non-food materials with 4 items were distributed to all families. GAA and CSHD modified and improved the previous model of PVC tent, but it was not accepted by the people. Instead, they wanted to improve the existing shelter. Hence, the ground was leveled and the floor was raised. Again, it had to be abandoned because people had wanted cash in hand to go into rented houses nearby, and the whole area was flooded, which forced them to leave. The government gave each family ₹1,000 for rentals, with the assurance that they would be given permanent housing soon. All along, the operation was executed in close coordination with and support from the state administration and the community. Impressed by the commitment and quality of work displayed by CSHD and GAA, the district collector asked CSHD to assess the situation of families in the left-out list in southern coast of Chennai. CSHD immediately took up the survey. Those in the list belonged to non-fishing communities and particularly Dalits. They lived amidst the fishing communities in huts or rented shelters. After the tsunami, they were almost chased out of the area. Having lost all their belongings, they were on the streets for over a year. The government's relief measures were totally inaccessible to them.
எல்லாருக்குமே வந்தது சுனாமி. ஆனா கவர்மெண்ட் மீனவன் தான் பாதிச்சான். மீனவனுக்கு தான் சுனாமி. மீனவனுக்கு தான் எல்லாம் செய்யணும். பண டோக்கனுக்கு மீனவனுக்கு தான் கொடுக்கணும். அரிசி பருப்பு கொடுத்தா மீனவனுக்கு தான் கொடுக்கணும். துணிமணி கொடுத்தா மீனவனுக்கு தான் கொடுக்கணும். அப்ப அங்க இருந்த மக்கள் எவ்வளவு பேர்? எல்லா பொது மக்கள் தான்.
The Operation 2005 has brought out the stark reality of discrimination faced by Dalits even at the time of disaster. CSHD team proactively interacted with these families and roped in the fishing community in building their facilities and ensured their support and cooperation. After the need assessment, CSHD listed out 1,622 target families in need as well as their priority needs. Non-food materials, 24 essential items were distributed to all targeted families.
உன் பேர் என்ன?
சூர்யா. சிக்கே. தலகாணி. சாமா. சாமா.
எல்லாம் கிடைச்சதா?
In 2 localities, 4 units of water tanks for storage of 12,000 liters of drinking water, 5 mobile toilet units and 40 dustbins were put up. 2 units of public toilet were renovated. 25 volunteers were trained in bat SAM.
I see the drastic change for the families in regard to the shelter, the living conditions the people were living in July and now. I see the drastic change with regard to the use of basic household items, non-food items which were not existing a couple of months back and now families can use. I see the improvement in the water consumption, potable water, drinking water, clean water for the kids, for the women, for the families, and of course the use of sanitary facilities. There's a lot of change, and all in all, this is really a good example where joining hands leads that about 21,500 people have been supported to overcome a humanitarian crisis.
We were able to achieve these results primarily due to the commendable support from European Commission and German Agro Action and their flexibility to adapt to the needs of the local community.
The implementing agency also learnt a few lessons. The strategies need to be child-friendly too. For example, children are not used to closed toilets. CSHD plans to probe further and devise plans to adequately meet the needs of adolescents, children and women. The experience and expertise gained in Operation 2005 have moved CSHD and GAA to explore into new areas. Accordingly, a survey has been done in Kanchipuram district, south of Chennai, targeting 2,062 Dalit families who were severely affected by the tsunami, but supported by none. With committed staff, clear strategies, and right partners, CSHD is confident of achieving sustainable human development among the target population.